tell my patients the two main things that can lead and give you risk factors for kidney disease are diabetes and high blood pressure. If your doctor or healthcare provider has diagnosed you with either high blood pressure or diabetes, and you've had this for several years, there is a pretty good likelihood that you may also have kidney disease. And this is where we physicians, nephrologists, or kidney doctors come into play, where we can help you diagnose that. So the first step I would say is to always get your primary care doctor to refer you to a kidney doctor if they suspect that you have kidney disease.
Live Doc Talk Live is a health show dedicated to educating listeners on different health topics. We do so every week by talking about different health topics and get answers from experts. You can find more information about our show on doctalklive.com. You can also follow us on Instagram, Facebook, and Twitter. Make sure to like us on our Facebook page and also subscribe to our YouTube channel. My name is Dr. Shri Venkatraman. I'm going to be hosting today's show, and we have a great topic lined up for you all. We are going to be talking about chronic kidney disease. It will be surprising to know about 37 million adult Americans have kidney disease, and many more millions are at increased risk for kidney disease. So I think it's important to know about the kidney disease. Early detection can help prevent progression of this kidney disease into kidney failure. So I have with me in the studio Dr. Melby Abraham, and she's going to be answering all our questions, and we'll get a lot more information. Dr. Abraham, thank you so much for volunteering your time to be with us. Welcome to Doc Talk Live. Can you introduce yourself to our listeners?
Yes. Hi, everyone. My name is Dr. Melby Abraham. It's very nice to be here today, Dr. Shri. Thank you for the introduction. I've got a little bit of a unique background here. I was born in India, and I'm South Indian, but I was born in the North. I was raised in the Middle East, and then I moved here in high school.
Nice.
So I moved to the United States. Houston is home for me, but now Dallas is my new home.
Welcome.
And after my residency and fellowship, I'm going to be practicing, and I'm one of the newest members of the Dallas Renal Group. So it's an exciting time for me, and I'm so glad to be here.
Thank you, Dr. Abraham, so much, and welcome to the ERG, and welcome to Doc Talk Live.
Thank you.
So we're going to be talking about chronic kidney disease. Let's first start by explaining to our listeners what is chronic kidney disease, and how do someone know that he has kidney disease, he or she?
Got it. Excellent. This is a very excellent, but a very simple question in essence. You know, a lot of people, like you were mentioning, don't know that they have kidney disease.
Yes.
And the first thing I tell people is to recognize that there are a lot of causes that can build up to kidney disease. I always tell my patients the two main things that can lead and give you risk factors for kidney disease are diabetes and high blood pressure. If your doctor or healthcare provider has diagnosed you with either high blood pressure or diabetes, and you've had this for several years, there is a pretty good likelihood that you may also have kidney disease. And this is where we physicians, nephrologists, or kidney doctors come into play, where we can help you diagnose that. So the first step I would say is to always get your primary care doctor to refer you to a kidney doctor if they suspect that you have kidney disease.
Gotcha. Dr. Abraham, so how do we know? Do we have to do a blood test or a urine test? How do I know that I have kidney disease? And can you also, I've heard people say different stages of kidney disease. If you can explain that to our listeners, that'll be great.
Wonderful. You're absolutely right. There's different tests, and especially blood tests and even urine tests that doctors use to measure specific numbers that suggest that you have some degree of kidney disease. In our clinic, one of the big things I tell people is that they should know what stage of kidney disease they have if they have it. So it's very easy. You know how you think about the $5 footlongs at Subway?
Gotcha.
So you've got $5 or 5 stages of kidney disease. So there's stage 1, 2, 3, 4, and 5.
Okay.
And stage 1 is pretty early in the kidney disease, where, you know, it's a good time to start kind of, learning more about what the kidneys do, what the kidney disease means. As you progress from stage 1, 2, 3, and get to 4 and 5, your kidney disease is getting pretty extensive, and you should be seen by a specialist, a kidney doctor.
Gotcha.
Usually our patients who get past stage 5 do require some sort of dialysis or some help because their kidneys have essentially failed and they do not work.
Got you.
Okay.
So you were telling us the risk factors are high blood pressure and diabetes. So I guess they have to take care of those.
Yes.
And does diet play an important role in kidney disease? People ask me, what can I eat? What is good for the kidneys and stuff? Can you elaborate a little more about that?
Yeah. You've probably heard this phrase, food is medicine. And, as a practicing physician, I really do believe that every food particle that you put in your mouth can either be poison or medicine. So diet is a big part of preventing and maintaining your overall health. Would I recommend that you follow a specific diet? Not quite until you've seen a provider, but I would say that a general healthy diet, especially when you have high blood pressure, we talk about the DASH diet or low salt diet, right? And with our patients who have diabetes, we talk about a low carb or a carb controlled diet. So those are all very helpful to prevent causes or to, I guess, slow the progression of high blood pressure and diabetes, because both of these take a big toll on the kidney over the years, and that's how people end up with having kidney disease. Especially when it comes to diabetes, I always highly recommend that you follow up with a dietitian so we can work on your diet. You follow up with a podiatrician, so you can take care of your feet. And you follow up with an ophthalmologist, an eye specialist, so they can check your eyes and make sure they're not missing early signs of diabetic eye disease. And a pro tip for you guys is also that your eye doctor can start seeing changes in your eye that can hint toward having kidney disease. So it's a 2-for-1. So I would say definitely get your eyes checked if you're a diabetic. Make sure that, we're not missing early signs of kidney disease.
Gotcha.
And, people always ask me too, Doc, what do I do about water? Am I supposed to drink water?
Yes.
Do I drink a lot of water? What's a good amount of water? It depends on your daily activity and your metabolism rate. So I don't recommend a specific amount of water unless I have to treat a patient with stone disease, kidney stones or such. That's when I recommend a higher amount of water. Generally, I say staying well hydrated and well nourished.
Good.
Those are my tips for you.
For the diet. Good. That's a very good piece of information about diet and water and stuff. That's great. Yeah. And what about, the people say about the NSAIDs like Aleve, naproxen, Motrin, they say they affect the kidneys. What is your take on that? And what's your advice for our listeners?
Ooh, let me go ahead and get my soapbox out and let me get right on top of it. NSAIDs or non-steroidals, these are a big, broad class of medications. And this is the one thing that I am always educating my patients about. Think about the last time you went to a Walgreens or a Walmart or a CVS. There's so many rows of medications.
Yes.
The two big things that you've probably noticed are Tylenol or ibuprofen or NSAIDs for a better word. So there's two big classes. Your Tylenol is acetaminophen, which is, very kidney safe. Of course, if you have liver problems, you should talk to your doctor before using it. But your Tylenol brand of medications are safe. And the generic name is acetaminophen. What you're talking about, Dr. Shri, is NSAIDs. Now, they can come in a lot of flavors. We're talking ibuprofen, naproxen, Motrin, Aleve, Advil, all BC powder, all the same name for a class of medications called NSAIDs. And these are very dangerous for kidneys, especially with higher doses and repeated use. So I highly tell, and these are the best ones that work for pain. Am I right?
Yeah.
With your knee aches, your back aches, your headaches. I always tell my patients, please limit the use of NSAIDs and be very active and conscious when you're picking out a pain medication at the clinic. Of course, or at the pharmacy. Of course, I recommend, non-medication related pain relief, trying things like yoga, acupuncture, meditation, deep breathing. And then if that doesn't work, you can use don't use NSAIDs as much, but I would say stick to maybe Tylenol or acetaminophen. Gotcha. This is not an ad. This is more an education for you guys.
Yeah, thank you very much. That's a good piece of information.
Yeah.
So now that we talked about the kidney disease, the risk factors, diet and stuff, do people have any symptoms? Do they have anything that they should be looking out for other than the blood test and urine test? Like, hey, this is happening. Should they be looking out for it? Is there any particular symptoms? Or, with heart disease, they complain of chest pain and stuff. But the kidneys, do they have any symptoms?
Yeah, great question. I think of the kidneys as like a Brita filter, right? You have a Brita filter that filters your water in your fridge. If your Brita filter is not working, those toxins and metals and all the bad stuff that should be filtered out doesn't end up being filtered out. So that's what happens when your kidney or your Brita filter is not working. Toxins start building up in your body, and that can make you very sick. People experience a wide variety of symptoms. A lot of people look out for symptoms like nausea, vomiting, changes in appetite, lack of appetite usually, a foul kind of taste in food. Some people describe it in my clinic as, "Doc, it tastes kind of like I chewed on a penny, like a metal taste in my mouth, or like when I bit my lip and I have a little blood in my mouth. That's what it tastes like." Yeah. Fatigue is another one. Fatigue out of proportion. Even though you're getting rest, you wake up tired and exhausted. Shortness of breath when you're walking. That's another big one. Chest pain, overall discomfort, and fluid building up. That's one big thing. So you'll see a lot of patients tell me, "Doc, even though I'm taking all my medications like you're prescribing, I notice that the fluid is collecting in my legs, it's collecting in my body, in my abdomen or my stomach." And those are all worrisome warning signs that you should be, more in touch with your doctor or get to a kidney doctor soon.
Got you. I mean, that is good to know. Yes. Yeah. Otherwise, people are like, "Hey, doc, I feel fine." Some of them, but they don't have to wait till this point to come to see you.
Exactly. And that's another thing I tell them. Every time you go to a clinic, especially if you're going to a kidney clinic, ask your doctor, "What's my stage?" And for our Spanish listeners out there, pregúntelo, ¿cuál es mi etapa? What is my stage? And your doctor should be very easily able to tell you whether it's stage 1, 2, 3, 4, or 5. Okay. And as you remember, as I mentioned earlier, as you're getting closer to stage 5, your kidneys are slowly deteriorating. So you do need more help and closer care.
Yeah, got you. I mean, now that you talked about the stages, when we come to stage 5, they're sad to know that dialysis, that's like the end of the world and stuff. So what are the treatment options for the kidney disease, especially closer to the end stage kidney disease? Can you enlighten our listeners that this is not, and what are the other options available? Hemodialysis, there are different types of dialysis, if you can talk about, and a little bit on kidney transplant, that'll be great.
Absolutely. The one big thing I want to emphasize is that when your kidney doctor tells you you have advanced kidney disease where you're stage 4 or 5, nearing the need of dialysis, please remember that we are your partners in healthcare. Yeah. This is not a death sentence. This is not I'm done, I can't move on. This is an opportunity for us to grow closer and to make a plan for you. Our goal is not to put everyone on dialysis, but sometimes out of, the need, we have to, so you can stay healthy. There are definitely a lot of options for patients, especially in this day and age. The traditional modalities we talk about is hemodialysis. Hemo is just a fancy word for blood, by the way. The hemodialysis or blood dialysis occurs 3 times a week. And, that's where you go to a clinic. You are set up in a clinic which is close to your home, convenient for you. You attend your dialysis sessions 3 times a week. The average amount of time that you spend at the center is about 4 hours. And people say, 4 hours, doc, that's too long. Yeah. But you got to remember, your kidneys work 24 hours a day. And now in a week, we're only doing 4 times 3. So that's 12 hours to clean your blood, remove the toxins, and get you feeling better. A lot of people like this modality because there's this choice of dialysis called hemodialysis because there's so many other patients there. There's doctors and nurses, and you have a lot of support. Yeah. So a lot of people like that. The second type of dialysis we do is something called PD or peritoneal dialysis. Peritoneum is just a fancy word for your stomach cavity or your abdominal cavity. This is a great modality of dialysis because this gives you some of this responsibility and you're taking matters into your own hands, which I 100% approve of. The good thing with peritoneal dialysis is you can do it at home in the comfort of your own home while you're sleeping or resting. Basically, we we train you and a family member, and we teach you very basics, and you don't need a Harvard law degree or a Harvard medical degree or a NASA degree to do it. We teach very simple concepts, and you can do dialysis at home with the machine that does it for you. And it's very easy. A lot of our younger patients like this because and a lot of our working patients like this because they like to, they have a lot more autonomy and freedom. So that's the second modality. And of course, we also have to talk about transplant. In this 21st century, we've made so many headway, and especially in the field of nephrology or kidney disease. Kidney transplants are life-saving, and you can do a live kidney transplant where a family member or a friend, whoever wants to donate a kidney, can donate one to you. And the most famous one I tell people about is Selena Gomez, who's from Dallas, Texas.
Nice.
And she had her friend actually donate a kidney. And a lot of our viewers may not know, but if you watch Modern Family, Haley, the daughter, she also actually had a kidney transplant from her dad and her brother. She had two, by the way. And of course, we also have a national database where a lot of donations can happen from deceased donors. So that's why it's important to recognize this early so you can get on the waiting list and your doctor can get you listed so that you can potentially avoid dialysis and get the transplant first. And of course, we are working on cool things like the artificial wearable kidney, but I hope, that's coming in the near future. We're just not there quite yet.
This is very good. Thank you so much, Dr. Abraham. It's very concise, the options, and this is not the end of life.
That's
we have
right.
options, and people still continue to work, go to school and stuff. That's very good to know. Yeah. So now that we talked about the treatment options and stuff, so is the kidney disease more prevalent in women, men, or equal, or have you seen any preferences or anything in the recent data that you could tell us?
Yeah, I'm not convinced I know the exact data points. I do see generally more men as kidney patients or patients with kidney disease, but that's not to say it cannot affect women. Kidney disease affects most of men and women across the board. It's very prevalent. Unfortunately, we don't talk about it because a lot of people know high blood pressure and diabetes, but they don't know anything about the kidneys. So that's why we're here to teach you guys, to start the conversation. And hopefully when you take this back to your clinics or when your doctors visit, you'll say, hey, doc, any chance I have kidney disease? Yeah, and that will be the first step. Yeah. Even young people can have kidney disease. There are genetic causes of kidney disease. So this is all very important for us to learn more about.
More about it. Yes. Thank you so much. I've heard of something called they see protein in the urine. I know it's just a very general term, but is that something, a precursor for kidney disease, or do we need to worry and do we need to more work up and stuff like that?
Yeah. So it's probably one of the first things you may hear if something is abnormal, that there's protein spilling or protein leaking in the urine. Your doctor may casually mention that and you may not think much of it, but it's something important to catch. Healthy working kidneys maintain a good protein balance, and you don't tend to lose any protein in the urine.
Okay.
Once you start having kidney disease and, your kidneys are getting weaker, they can start spilling protein. Okay. Now, this is not something you see in the urine. Like, you can see blood in the urine or you could have kidney stones. This is not something you see. This is a lab value that we measure in the clinic.
Okay.
That's why when you usually get a yearly physical, we do a full blood test. We also check your urine because the urine gives us a lot of hidden ideas about what's going on. If you hear your doctor say that there's protein spilling in the urine, a good follow-up question is to ask if it's serious, if we need to do a second step, or if you need a referral to the kidney specialist.
Gotcha. Thank you so much. So as a kidney specialist, you take care of all kinds of patients, I guess, correct? And other than what other things that you as a kidney specialist, you would be seeing, like you will be referred by your primary care doctors. Would you enlighten us a little bit? What other specialties or subspecialties in the kidney disease that you would be treating and stuff?
Yeah. The kidney doctors are one of the coolest doctors there is.
That's
I just
nice.
have to go ahead and say that. I know we like our neurologists, our brain doctors, we like our heart doctors, but I got to say we don't get enough credit. The kidney doctors need a lot of credit. Kidney doctors actually work across the board. We work in the hospital dealing with critical emergencies in the ICU, in the emergency rooms. When a patient gets very sick, kidneys are sensitive. They're like teenagers. They get upset very easy. So something goes wrong, your kidneys can shut down and you need a kidney specialist. So that can happen in the inpatient setting in an ICU or an ER. Kidney doctors also work outpatient in clinics. And there's many clinics that we work at. We kidney doctors get referrals from primary care doctors for proteins spilling in the urine, like you were saying, for kidney stones. Most men tell me it's like having a baby. I've not had one, so I can't relate. But we get a lot of referrals for kidney stones. We get a lot of referrals for genetic conditions like autosomal dominant polycystic kidney disease. That's a big word there, but it's basically you have large cysts on your kidney and it's genetic. So that means we have to take care of you, your father, your brother, and potentially your children. So we tend to be your long-term doctors. Kidney doctors also deal with overdoses because dialysis temporarily can help, take those toxins out of your body. Kidney doctors also deal with pregnancy and kidney disease. That's another fancy thing to think about. We see a lot of pregnant patients because pregnancy is a big stress on your body. And sometimes the kidneys can manifest kidney disease during that pregnancy time. Especially in Dallas, we deal with a lot of lupus. Again, Selena Gomez is someone who talks very strongly about lupus, which is a chronic kidney condition. So basically, we're your partners in life. We're doctors for life. We almost become like family where we know everything about you. And especially if you have a genetic thing, we know every single line. We know your grandparents, your parents, you, and now your kids. So don't be scared. We're here to help and we're here to help across the board.
Good. So the kidney doctors do a lot of things.
That's right.
They work in different situations and stuff. So I'm sure it takes a lot of years to get here.
Yeah.
I know you just graduated from fellowship. So would you tell how long and what would you tell about your experience of journey of getting to be a nephrologist and how passionate this is for you to do this and stuff?
Yeah, so for any aspiring kidney doctors out there, no matter where you are in life, I think it's a great journey and I think you should definitely embark on it. Be prepared to do the work and be prepared to never give up. Keep going. That's my goal. I always say the kidneys are very resilient. They're tough. They fall very easily, but they fight and they come right back. That's a goal for you. In general, after your college degree, you have a bachelor's of some sort. You either take a bachelor's in some sort of a science degree. You end up in medical school. You'll do 4 years of medical school. Then after medical school, you have your general medicine residency. Most kidney doctors do an internal medicine residency. Internal medicine just means all the organs on the inside. So, you're basically learning about everything. Your heart, your kidneys, your lungs, your liver, skin, everything. After a 3-year residency, you'll do a special training, which is where you really learn more about kidney disease. That's called a fellowship. That's about a 2-year program. So we're talking 4 plus 3, that's 7, plus 2, that's 9, close to 10 years of training just to get to be where you are. But I got to say, I love the kidneys. I think they're fantastic organs, and I think we need to give due diligence to the kidneys.
All right. That is great. That is great. We talked a lot of great information in the short period of 30 minutes. You were able to tell us about what is kidney disease, what causes it, what prevents it, and treatment options, and a lot of new things available. That is fantastic. Just one more thing, the people who do workouts and stuff, they drink all this muscle milk, muscle protein and stuff. Do they have any effect? The young people, they want bodybuilding and they creatine kinase. Do they have any effect on the kidneys? Anything that you would like to say? Yes, and stuff. Yeah,
so that's actually another common question that comes up in clinics, especially with our younger guys who are trying to look buff, taking your creatinine supplements and higher protein diets. Definitely with active working kidneys, you shouldn't have a problem, but you can see some changes in numbers. For example, if they check a urine test, they may see a higher degree of protein that's leaking into the urine. I always say, if it's one number, I wouldn't jump or worry without repeating the study and then potentially seeing a specialist. These supplements are unfortunately not all FDA approved, so I'm very cautious, and I warn all the listeners, be very cautious, do your own research before you take any supplements, weight loss pills, diet fads, all of those. Like I said, kidneys are sensitive organs. They're like teenagers, so sometimes you may trouble them by taking stuff that's not FDA approved.
Thank you. Listeners, we are coming closer to the end of the show. Thank you, Dr. Abraham, for a wonderful piece of information that you gave us. Any last-minute tips to keep this kidneys going and be strong and resilient? That'll be great to our listeners.
Absolutely. One of my favorite things to tell my patients is that you should always know what is your stage of kidney disease. So next time before the doctor steps out and they say, hey, do you have any questions for us? Go ahead and ask them. Hey, doc, what's my stage of kidney disease? Gotcha. And of course, as for my lovely Spanish listeners, pregúntelo por favor, ¿cuál es mi etapa? And learn that there are 5 stages of kidney disease.
Thank you so much, Dr. Abraham. Listeners, we are coming to the close of the show. We had a great talk with Dr. Abraham. Please tune back to us next Wednesday between 5:30 to 6 at 100.7. Make sure to follow us on Instagram, Facebook, Twitter, and like.